In this video, we'll discuss differences between delirium and dementia. Print in red on top is that for delirium, and that below with blue color is that for dementia. Onset of delirium is abrupt, whereas that of dementia is gradual. Mental status. In delirium, there is acute impairment of cerebral function causing confusional state. In dementia, there is slow, gradual decline in cognitive function. Outcome. Delirium is reversible, whereas dementia is irreversible due to degeneration of the brain. Primary features. In delirium, there is fluctuating consciousness from hyperarousal to lethargy to coma. Example of hyperarousal delirium is that of alcohol withdrawal, and that of hypoactivity or lethargy is opioid intoxication. In dementia, there is memory loss. Patient is unable to do activities of daily living. Consciousness. In delirium, there is confusional state and clouding of consciousness with fluctuating consciousness. In dementia, patient is conscious. Fate of the disease. Delirium becomes normal after a period. In dementia, there is gradual deterioration, and finally the person is disabled and die. Age. Delirium may occur in younger people. Dementia occurs after the age of 50 years. Orientation. In delirium there is temporary disorientation, and in dementia there is permanent disorientation. Amnesia. Delirium there is anterograde temporary amnesia, whereas in dementia there is memory loss which is permanent. Sundowning. Present in delirium and absent in dementia. Causes of delirium are medication, illicit drugs, toxins, hospitalization. Causes of dementia are old age, cerebral atrophy, Alzheimer's disease, frontotemporal dementia, and Lewy body dementia. Precipitating factors. Delirium, medication, illicit drug, toxins, hospitalization, and surgical procedures. In dementia, precipitating factors are aging. Etiology. In delirium, there is interference with cerebral function. In dementia, the cerebral and hippocampal atrophy. Dysfunction. In delirium, there is diffuse cerebral dysfunction. In dementia, disruption and damage to cerebral neuronal circuits. Pathology. In delirium, there is diffuse cerebral dysfunction, confusional state, and clouding of consciousness with fluctuating level of consciousness. Dementia is a progressive neurodegenerative disorder. There is disruption of cerebral neuronal circuit, cognitive impairment, loss of memory with loss of orientation, diffuse degeneration of cerebral cortex and hippocampus, amyloid, neurofibrillary tangle, ApoE4, tau proteins, Lewy body, and chromosomal mutation. EEG. In delirium, there is symmetrical slowing, indicating a diffuse cerebral dysfunction. EEG in dementia is helpful for seizure disorder. Like Creutzfeldt-Jakob disease, there are repetitive bursts of diffuse high voltage sharp waves.